Inspired by the humanitarian icon and founder, the Nelson Mandela Foundation uses the indomitable legacy of Nelson Mandela in the center of memory, together with his approach through dialogue to bring about social change with community conversations.
Talking about the problems in a very, very open and transparent manner can empower people to understand their problems far better. I think that's the difference between the community dialogues and the other advocacy messages, as the communities themselves are talking about what it will take to stop the spread of this disease.
They are a process that allows the community members who are experiencing these challenges to find their own solutions and feel empowered to bring about their own decisions.
The process of engaging communities in dialogue is implemented through the Community Capacity Enhancement methodology that empowers communities to tackle their own specific challenges from a bottom-up approach.
The methodology is adapted from something that the United Nations Development Programme pioneered over the years in other parts of the world.
Give credit to the way that Africans have handled their meetings from way back. In the times of our forefathers, we would have lekotlas or imbizos under a tree, but decisions were made there and societies were controlled.
And we then fashioned this program to go out to communities through this methodology that has been used around the world by UNDP, called Community Capacity Enhancement.
Community Capacity Enhancement is about really focusing on identifying challenges around HIV and AIDS or any social justice issue and coming up with solutions as a community.
Once we then start having conversations as everybody in the community, then we can then have a sense of direction as a community, you know, to achieve whatever that we want to achieve.
When we talk of CCEP, we're talking of a 6-step methodological movement, a cyclical movement. So it's establishing relationships, it's identifying concerns and exploring those concerns, and then making decisions on those concerns, and then acting on the concerns. Then you go back to review what you've been doing. And this is something that this cycle is done by the community.
To see results at a national level, it is necessary to understand the specific challenges that further the spread of HIV and AIDS at a community level. Through their Community Conversations program in various rural, peri-urban and urban areas in South Africa, the Nelson Mandela Foundation has uncovered various factors that influence HIV and AIDS in each area. The community dialogues are run in 11 communities across 9 provinces in South Africa, each with its own unique challenges. In KwaMakuta, the emergence of a new drug called Wunga, made with ARVs, has begun impacting HIV and AIDS treatment in the area.
Inkinga esibhekana nayo kakhulukazi la endaweni yethu yakwaMakuta amacala anjenge rape, anjengama assault GBH, ama housebreaking namanye amacala esiwabiza nge-trio crime.
Lama ARVs siyawathola ngokuthi abantu bebewalanda ebhedlela sikwazi ukuthi sibabambe inkunzi sibaphuce wona noma basidayisele wona lawo ma ARVs sikwazi nathi ukuthi siyodayisela labantu okuyibona basidayisela yona iwunga sebeyimixile basiphe bona iwunga thina sibanika ama ARVs.
Through the community conversations, police and local government were engaged to resolve the scourge of crime in the area.
Eqaleni lekhulunywa ngo-youth against drugs bekuyinto umuntu abangayinakile leyo engenandaba nayo ngoba bekumnandi mesibhema enjoyeka yonke into yethu imnandi kodwa manje isimo umuntu asekusona sengiyabona manje ukuthi kahle kahle ku-wrong.
In the rural area of Tabanchu in the Free State, crime has lured youth into an unhealthy lifestyle that fuels ignorance about the threat of HIV and AIDS and is causing a problem in an area with an already high HIV and AIDS prevalence.
A lot of children are more involved in crime. They are more involved in crime, things like drugs, Most of them, we have a lot of gangs here.
Thanks to community conversations, there is now more clarity about what needs to be done to curb HIV and AIDS in Tabaju.
People are very shocked. People are very scared about what is happening. So they feel that now enough is enough. You know, they must stand up and, you know, we must try and protect ourselves.
In Khalishiwe in the Northern Cape, there is a high rate of risky sexual behavior from teenagers and thus pregnancy brought on by alcoholism.
Apparently Khalishiwe was one of the, rough townships. But now things are getting better and better and better. It was difficult for us to walk in the streets, even though we were small children.
With alcoholism crippling the youth and some adults too drunk to listen, community leaders are now more aware of the cultural aspects that need to be focused on, thanks to community dialogues. Throughout the country, the conversations have uncovered HIV and AIDS-related concerns unique to each area, assisting each community to empower themselves.
We believe that the only way you're really going to deal with this disease is to empower communities to deal with the underlying problems themselves.
An essential element to address an issue of this magnitude is partnerships, as it cannot be solved by any single man or organization.
Partnerships that support community dialogue, we can call them human capacity for response partnerships, if you like, where together we, the organizations, and we, the systems, commit to pushing the community dialogue, but not forcing it, to learning from it, and to having our own people involved in continuous learning and bringing back that learning to our own organizational lives.
Talking about local government, we're talking about business, we're talking about schools, we're talking about faith-based organizations, NGOs. Let's all come together. Instead of working in silos, let's come together and just push this one big truck towards a solution.
With an investment from funding partner GTZ, the Foundation has been able to extend the Conversations program to more of those in need.
Well, GTZ is an organization which belongs to the German government. It's a typical parastatal. It's legally Pty limited, but 100% owned by the German government. And it implements development programs, mainly for the German government, all around the world, in more than 100 countries.
Obviously, we depend on public donations and support from governments like Germany and from GTZ to turn this into structured programs so it can have an impact.
It requires money. I mean, simple as it might sound, to host a conversation, as simple as that, getting people to a hall to come and talk about it.
Germany has an interest that South Africa and Africa as a whole has a peaceful, stable development. And as you know, South Africa is extremely important for the continent, for the economic development of the continent, of peace and security in the continent. And that's why Germany, through its aid agency, GTZ, is active here in the country.
They're making a difference. I think any funder who's in any country is development funding, a very difficult area around the world, is the need to know whether you're a government or whether you are the humans that are working for that government, is to know that you are making a difference.
The community conversations have undoubtedly been making headway to alleviate HIV and AIDS concerns. However, there is still a long way to go before the issue of the pandemic is resolved.
I've seen in my time people that died needlessly, people that I saw and I knew if they had treatment, they'd be alive tomorrow to hug their children. Without treatment, they'll be dead before the week goes out.
It's a disease that doesn't recognize borders, doesn't recognize nationalities, doesn't ask you for a passport before it infects you.
Today, nobody has to die from HIV/AIDS anymore.
There is absolutely no reason why we should be getting new infections. I mean, for me, it's quite frustrating. There's no reason why people should be dying of HIV-related illnesses now.
And unless the community gets into dialogue, you really don't know half the story of what happens behind the scenes, and you cannot change behavior.
Where there have been successes in turning the tide of the disease, it is where people have spoken about it.
The community conversational approach that builds the space for people who live in their homes and their neighbourhoods to make a response to HIV will in fact create a very different picture, I think, to HIV in this country in years to come.
The conversations are an essential part of engaging the community in that dialogue.
We want to spread them all over the country.
If we're truly going to have impact, you have to replicate these kind of dialogues throughout the country.
Many people in South Africa today have thought that AIDS is a thing of the past, but no, it's not. It's a thing of the future. This pushes forward in a way that improves care, reduces vulnerability, gets prevention outcomes, changes behaviour, and makes people much more optimistic and confident.
So it's very empowering for community members because it allows them to feel adequate, to feel that they've got the power within to bring the change themselves. That's why I believe in it so much.
I lost uncles, I lost aunties, I lost cousins because of HIV, and I owe it to Mzansi, change the behaviors about.
And the most important thing is just to know that there are people out there who care for others with the disease.
Each time we have a conversation, because I know something is from a community, and knowing abantu bayimisele kangaka. Yeah, I think even though it's a process, because I think it won't take that long to see change, as in proper change kwamakutha, because abantu indlela abenza ngayo bangimangaza kwamina.
Talking about it leads to an acknowledgement about your own behavior, but also about your responsibility to your fellow community members.
As daunting a task as it may seem, it is still possible to stop this disease from killing.
HIV is a major issue that we got to confront as a nation. It's a developmental issue, it's a human rights issue.
It's the #1 killer. And it doesn't kill people's bodies physically, it kills the spirit.
So we have to stop this epidemic, and it's possible.
We have to respond to the crisis that is threatening our communities. Every effort to change the current behavior of people must be a priority to all of us. Break the silence. Talk about HIV and AIDS.